Good morning. I'm going to do an incentive spirometry. So the first thing I'm going to do is check the patient's chart. I'm going to look to see if they're a post-op patient and or if there are any pain medications like that. And so this machine is going to help them open up their lungs and clear out their lungs. So first thing I'm going to do is knock on the door, introduce myself, and then I am going to check the patient's ID band, and then I will proceed to wash my hands before I do anything else with the patient. I will apply my appropriate PPE. And then I will assess the patient. So I'm going to listen to the patient's lungs, and then I'm going to check their vital signs, and then I will tell them about what I will be doing with them. And so here we have a volumetric exerciser. So this is going to help them open up their lungs. It's going to strengthen their lungs to help them clear out any secretions, help them prevent atelectasis, and improve their breath sounds for them as well. So here it comes with a chart, and so you'll go based off, I'm going to use it as examples. So it goes based off female or male. So for a female here, it says the height and age. So I'm going to be between 1900 and 1850. So I'd reposition the patient. I'd make sure the patient is set up to where they can get a nice good expansion with their lungs. And I'd also have them, if they are post-op, I can have them hold a pillow if that makes them feel more comfortable and a little less pain for them. And so I position, once I have them positioned, I'll prepare everything for them. So I prepare with the yellow here. I set it at where they're supposed to be at, and then I can see where the piston goes and if it reaches to that level or not. And so I connect it to here. I connect the tubing in like that. Make sure it's tightly on. And so I instruct the patient to have it sitting like this. And so when they go ahead and do it, I will have them take a nice deep breath in, and I'll have them exhale. And I'll tell them to exhale all the air that they have in there, try to do the best they can. And when they go to inhale again, I'll have them put this in their mouth and make sure they have a tight seal around the mouthpiece with their tongue underneath the mouthpiece, and not occlude the mouthpiece. So when we're ready, I'll have them take a nice deep breath in, then exhale. So when they do the inhale, I'll have them do a 3 to 5 seconds hold. And then when they go to exhale after doing the breath hold, I'll have them exhale away from the mouthpiece so that way they don't blow into here and get any moisture in there. And then after every treatment, I'll have them cough if they have any secretions that they need to cough up or anything like that. And so if they do cough up anything, we can have something like a basin or something to that they can cough up into like that. And when they're done with this, you can set it next to their bed. So you would instruct them at least 6 to 10 times. But if they are unable to do it and they don't feel comfortable doing that many times, you can just set a goal of how many times per hour for the first few times, and then set a goal if they don't reach their maximum where they're supposed to be, then you can just set a goal that they can reach throughout their practicing. And so every hour we can come in and practice with them to make sure they're properly using it. But this can be washed with sterile water if they're finished with it. Otherwise, you can set it out to air dry. And then this here, you can put the patient's name at the bottom, the patient's room number, the date that you gave them the machine, and set it to the side. And then when I'm done with their treatment, I will reassess the patient, listen to the lung sounds, and then I'll check their vital signs, and then I would remove my PPE, and then I would wash my hands. Then I go chart on the patient's chart what I did for them, and so then that way the doctor and nurses know that what I've done.